Okay, it's 3:48, so I think that we can get started. Thank you all for joining us for today's session, Building Change from the Ground Up, a training on local policy and advocacy for reproductive freedom. We're excited to have you here. Wish we were all in person, but this is still not a bad way to spend a Saturday. We do have a host from Justice Now with us who I think if you have any logistical questions can answer them. My understanding is that this session is being recorded. We will also have time for questions for this presentation at the end, so feel free to chat in your questions or to put them in the Q&A. And I'm not sure if we'd be able to unmute you at the end or not, but chatting in is probably the best way to ask any questions or make comments, and please feel free to use the chat box. We always like that. Okay, I'm going to get us started. So we'll kick it off with introductions. Since I'm talking, I'll just keep going. My name is Jenny Dotson Mystery. My pronouns are she and her, and I am the Associate Director of Local Advocacy at the National Institute for Reproductive Health. We're based in New York City, but we work all across the country, and we'll talk a little bit more about what we do later on.
Hi, everyone. I'm Arpita Panagari. I am the Policy and Partnerships Manager at the National Institute for Reproductive Health. My pronouns are she and her, and I am Jenny's coworker.
Are we introducing ourselves?
Yeah, sorry.
Hey, folks. No, that's
Go ahead, Meg.
That's perfect. Hey, folks. I'm Meg Sassy Stern. I am the Abortion Support Fund Director for Kentucky Health Justice Network. I'm also a volunteer with the Louisville Clinic Escorts, and I'm the person wearing sunglasses closest to the camera in this photo. Happy to be with y'all.
Hey everyone, my name is Allison Kaufman, she, her pronouns, and I am the director of Amplify Georgia, working locally here in Atlanta, Clarkston, and South Fulton.
Hello everyone, my name is Soraya Sharker. I am the community organizer with the National Asian Pacific American Women's Forum, or NAPAWF for short. I am currently working with AAPI communities in Clarkston and Doraville, Georgia.
Great. Thanks, everyone. You'll get to hear more about what we all do as we get started. But while we're doing that, we wanted to learn about who's joining the session today as well. So could you just chat in your name, where you're from, and why you decided to join our session today? Make sure you can see that there's like that little blue box. I put an example here where you can either chat in to just panelists or to everyone. If you could just chat it in to the whole group so we can all see who's in the room, since we can't physically be together, that would be great. You can see I put my example here on the bottom of the slide. We'll keep moving on, but if folks want to start chatting in, thanks Tiffany for kicking us off. We'll see your responses coming in as we begin the presentation. So I wanted to start by framing this conversation by talking about why local advocacy matters and why we decided to come together to talk with y'all today. So there are a lot of different reasons why I think local advocacy matters. And for the purposes of this slide, I'm thinking of them in two buckets. So there's these first three bullets that I'll talk through, which are about the characteristics of local advocacy that I think make it really great for our movement. So the first is that it's accessible. I often think about this when I think about young people, but really it's for pretty much anyone who might struggle to get to the Capitol to testify at a hearing. And that both means in terms of timing, it's hard to get a day off because Capitol meetings usually happen during work hours, and city council meetings sometimes do, but often are in the evening. Of course, it's also about travel. If you don't live in the capital city, then that means you need to your folks need to figure out how to get there, which can be a barrier in many ways. But it's also about the fact that, while it can be intimidating to show up at a city council hearing to speak, it's a little more accessible, I think, than having your first moment of giving testimony or engaging in a protest being at the state capital. So we think that it's accessible in a lot of ways. And I want to emphasize that's even more true now. City council, city government, county government typically is still happening. And actually it's mostly happening on Zoom, although in some places it's still in person. So I think we'll talk about that a bit more, but the Zoom, using Zoom for city council meetings can make it more accessible for some, although less accessible for those who have challenges with technology or broadband. It's also a really great way to build relationships between yourselves as local advocates and your organization and elected officials. By that I mean, and I think Meg will have a fun story about this when Meg presents, but your elected officials on the local level live in the same community as you, so you can really bump into them. They know, you might know them. Often I find when I'm working with people on the local level that their friend happens to be on the city council or work for the mayor. And so it just is a little bit easier to start to reach out to elected officials. There's less advocacy organizations doing local work often, so they may be more easier to reach in that way as well. We think that's important for the impact you can have locally, but also because elected officials on the local level often seek higher office. My kind of classic example of this is that we worked quite closely with Representative Ayanna Pressley when she was on the Boston City Council on work to support abortion coverage and repeal of the Hyde Amendment. Representative Pressley also led some incredible work in Boston on comprehensive sex ed. And, as we all now know, she is now a powerful and well-known member of Congress, and we have had that relationship with her. It doesn't always happen with someone who's as well known, but folks are constantly, elected officials have ambition. So it's a great way to get your foot in the door with them now and maintain that relationship as they rise in office. And then, it's a good way to build meaningful cross-movement partnerships. Again, this can be true at any level of government, but it feels a little bit more attainable on the local level when it's fewer people, when you all are working in your community. So we're thinking about, allying with your local voting rights movement to ensure people can vote safely, and really like meeting, building together, and then, those same folks showing up for you when you need to call on them. Then the other two bullet points I have on here are just why local advocacy itself really matters right now. So the first is that, and you can see from my map, which looks kind of pretty with the stars on it, but is actually a really sad map, how far many people have to travel to access abortion care. It's an unfortunate reality that most people will have to come to a city to access reproductive health care. With the gutting of Title X under the Trump-Pence administration, that's not just abortion care. That can often mean any type of family planning care, access to contraception, et cetera. And so when you pass a policy on the local level, of course, it benefits the residents, but it can often benefit anyone who's traveling to your city for care. So that's one thing. And I think in Meg's presentation, you'll really see how if and when they are successful, that it would benefit more than just folks living in Louisville. The other thing that's really important is that anti-abortion groups are using this strategy. My example about Roswell on here is from 2019, I've had examples of this going back to when I started this job in 2012. So it's always been a strategy for the anti-abortion movement, but it's really become a big focus of them. I'm sure that you all have seen examples of these sanctuary cities for the unborn. Just 2 days ago, I was on the phone with folks in Florida talking about a city where they are trying to pass 4 different actual anti-abortion ordinances locally. So we need to meet them on this battlefield as well, where they are. So it's really important for us to have a local presence and to both play defense and offense locally. And we're not going to talk about this today, but we do have 2 toolkits on battling anti-abortion ordinances locally. One developed by NIRH, that's general, and then one we can point you in the direction of, developed by advocacy groups in Texas, talking about their particular work defending against resolutions and ordinances in East Texas. And I'll turn it to Arpita.
Thanks, Jenny. And hi again, everyone. So one of the things that we wanted to be sure to hit up at the top of this webinar is why local now? So during the COVID-19 pandemic, which is obviously ongoing, state legislative sessions became even more unpredictable than they usually are. For those of you who have been involved in state legislative processes before, you know that legislative sessions, while they're unpredictable, they are also really regimented, and there's a lot of ritual that goes into a state legislative session. Unfortunately, because of the abject failure of our federal, state, and local governments in managing the COVID-19 crisis, we will likely continue to see really haphazard or even truncated legislative sessions through 2021 at the state level. But local advocacy can thrive because it is adaptive, because it is responsive. As Jenny said, a lot of times local officials, city council members, county seat members, they will sit in your neighborhood. They have offices 10 minutes from your house. And even though we can't go and see people in person, local officials will be more likely to set up all different types of ways for their community to reach them because they're in the community. They can't escape. And so during the COVID-19 crisis, something that I really wanted to highlight is that we've seen some really incredible successes from local level responses to the various attacks on abortion access that we saw coming down from the state level under the guise of, protecting people from COVID-19. We saw multiple governors stand up and say abortion is non-essential. And in response, we saw local advocates stand up and say, absolutely not, we will not accept this. And we saw city councils stand up and say, abortion is protected here. Your access is protected. You can go get care when you need it. And, that kind of advocacy is so effective because it is so local, because it is kind of isolated to really specific areas. And so I wanted to highlight that those successes kind of are the key to why we're talking about local right now as the way to go and the way to move us all forward. I also want to highlight that right now it's 40 days of life and 40 weeks of harassment, and I'm sure you'll hear more from Meg especially, but this is the time when local folks really stand up and show up to let people know that we care about life because we wear our masks. We don't force people to believe what we believe. We are showing up and showing out, and I'm so excited for you guys to hear more from everyone else. And with that, I'm going to go ahead and throw it to Amplify Georgia and Allison and Soraya.
Thanks so much, Jenny and Arpita. So we're going to introduce Amplify Georgia and some of the local work we've done. I'll speak a little bit to the Atlanta work, and then Soraya will speak to some of our work in Clarkston and some work that she's leading and collaborating with others on related to the Irwin County Detention Center. So just a bit of context around Georgia. So Georgia has the highest or one of the highest maternal mortality rates in the country. And it is 3 times higher for Black mamas than it is for white folks and white Latinx folks in our state. 96% of Georgia counties have no abortion provider, 50% have no OBGYN, and 40% have no pediatrician. We are also one of the states that has the highest rates of rural hospital closure. So accessing care, as Jenny was showing in that map, is incredibly difficult for folks. So this is literally a matter of life and death, and people aren't able to access the providers, aren't able to access the care they need, especially folks who are not living in the urban centers. Georgia is also a health hub for the South. So we are a destination, and specifically Atlanta, a destination for care and specifically for abortion care. And just another data point is that 13% of Georgians are uninsured, and that is the third worst rate in the US. So there are a lot of economic barriers to accessing care, abortion, and beyond. And then in 2019, as I'm sure a lot of folks have heard, Georgia passed a 6-week ban on abortion. And we almost mobilized enough folks at the state level and flipped enough votes to prevent it from passing, but it passed by a very slim margin. And then we took it to the courts and defeated it this past spring. We were able to get it blocked by a judge, and it never ended up going into effect. But we've seen these bans happen across states, across the US, especially in the South and especially in the Midwest, and know that a lot more needs to be done to safeguard access to abortion care. And I just have a point at the bottom of the slide to say, despite these huge needs, like, we are really struggling to access, to implement change at the state level. And that's where Amplify Georgia and our partners decided to hone in and focus at the local level a bit more. And if the interpretation, having my video on is challenging with the interpretation, I'm just going to turn it off. All right, so Amplify Georgia, we are a campaign working to protect, affirm, and expand access to reproductive health care in Georgia cities. And specifically, we're working in Clarkson, Atlanta, and South Fulton right now. And we do base building, advocacy, education, and culture shift work. And I think a really important aspect of our work is the partnership model we have. So we are working with 7 organizations doing work here across Georgia. So NAPOF, which Soraya is representing, Feminist Women's Health Center, which is a local abortion provider, URGE, ARC Southeast, which is a local abortion fund, and I believe they work in 5 or 6 states across the Southeast, Spark, Sister Song, and the New Georgia Project. And just as I noted earlier, this Amplify Georgia came about from doing an analysis of what is happening in Georgia and really feeling, and I've seen this noted in the chat, feeling like we were constantly being reactive, especially in our work at the state level, that a lot of energy, a lot of effort was going into preventing backsliding. And folks were thinking, okay, where are there places that we could maybe advance and be a little bit more proactive in advancing and expanding abortion access? And then the South and red states, it's important to look at the local level and see, okay, what are the cities, what are the towns where we might actually be able to create some wins, create some momentums, and then put upward pressure at the state level. Next slide. Next slide. So one of our more successful campaigns has been around creating a Reproductive Justice Commission. So the Reproductive Justice Commission is a body of service providers, local nonprofits, community members, and advocates who advise decision makers on ways to improve and expand access to comprehensive reproductive health care. And that includes abortion access. And that is in recommending policy solutions to city councils and commissioners, other programmatic recommendations, and conducting public awareness campaigns. So I'll say a little bit about what this campaign looked like in Atlanta and some of our lessons learned from that, and then send it over to Soraya to share about our learning in Clarkston. Next slide. So as I mentioned, we were working with a partnership of 7 organizations. So it began with us doing kind of a deep dive and researching what are the possible policy tools and actions that can be taken at the local level. Because of course, at the city level versus the county level versus the state level, there are different different tools in those policymakers' toolbox. So understanding what could be done and what our ask should be was a really important first step. So we had a 2-day retreat to talk about what our specific asks and agenda might be for each of our cities. And that's especially important if there isn't kind of like one obvious thing you want to focus on. Like in some cities, and I know Meg's going to talk about this, there may be, you may know like, oh, we really want to work on like a buffer or like a bubble around abortion clinics. Like this is a huge need for us. Here in Atlanta, we were looking at, okay, there could be various things we want to ask for. So we created an agenda, which allowed us to go to the local city council members and start conversations about what were some of the things that we wanted to ask for and what were they interested in. And from those conversations came this idea for moving forward with the Reproductive Justice Commission. And then another lesson learned was just to seize the moment. When HB 481, the 6-week abortion ban was passed, city council members issued a condemnation of that bill. And that was our window of opportunity to say, great, like you guys are supporting, you are in favor of abortion access. Like it is time for us to advance policy and to actually take action around expanding abortion access in Atlanta. So thank you for that condemnation of HB 41 and like, please support this resolution. And another thing we did to create and leverage momentum was we partnered with NIRH when they launched their local reproductive freedom index and created an opportunity for media attention for the sponsor who wanted to move forward with the Reproductive Justice Commission. And so by doing that, we created a moment in time when he could announce this idea and share how our city and the city council specifically was moving forward with protecting reproductive justice. Another note I have is that you have to be ready to act quickly. So luckily, we had been having these conversations with Councilman Faroki and had drafted language for the Reproductive Justice Commission. But we actually weren't ready for him to move and introduce the Reproductive Justice Commission right after that press conference. It caught us off guard, and we had a very short window of time to negotiate some of the language. And when it was introduced and then referred to committee, we had some concerns about some of the language that was included in that bill, including some of the gendered language that was used, and really wanting to make sure it was inclusive and also specifically called out our communities, Black and brown folks, immigrants, young people, as needing representation on the commission and as like specific stakeholders on which like the commission needed to focus their work and their policy advice. And so that was our opportunity to mobilize our base, to bring some of our base members, some community members to talk to and advocate with the city council members about some of these language changes we wanted. And it was really exciting to see one councilwoman in particular who, we brought her constituent in, we had a conversation, and she recommended an amendment to make all the language in the resolution gender neutral. And she gave a little speech when she said it, and she was like, I don't fully understand this. I don't fully understand this need, but it is something my constituents are coming to me with, and I think it's important to make this change. And we were actually able to get a lot of the changes introduced before it was formally passed by the broader city council. And yeah, I'm going to hand it over to Soraya to talk a little bit more about some of the lessons learned from Clarkston.
Yes, thank you so much, Allison. If we could go back to the last slide. So while Atlanta was very successful, we weren't as successful in Clarkston. We weren't able to pass the Reproductive Justice Commission in Clarkston, sadly. And there were some lessons learned from there. Firstly, I would like to talk about the things that we did well, which was centering the community. So before we proposed a legislation for the Reproductive Justice Commission in Clarkston, we held listening sessions. And to prep for those listening sessions, where we would invite community members, NAPOF canvassed the city of Clarkston and built a relationships with folks months in advance. Afterwards, when we were hosting the listening sessions, we made sure that they were as accessible as possible, having interpretation, providing transportation, providing food, childcare, as well as giving people a $25 gift card for participating so that they could take time off of work. However, the positives of like having these listening sessions was that the language used in the building of like the Reproductive Justice Commission in Clarkston centered the issues of the residents of Clarkston because they're very unique and very different from those of Atlanta. And then once we were introducing the Reproductive Justice Commission in Clarkston, we were able to get speakers from our listening sessions as well as from our bases in Clarkston to come and share out their stories. The stories that were shared were very memorable. So the interesting thing was when we were reintroducing the RJC and getting a vote on it, which happened a couple of months, I believe it was 2 or 3 months after we originally introduced it due to COVID. Everyone remembered the stories of our participants, but people forgot the RJC, or like the council members forgot the RJC. And the lesson learned from there was that while we were focused so much on building relationships and bases with our community members in Clarkston, keeping those relationships, we forgot to continually reach out to city council and build more relationships with them, having more one-on-ones with them, reminding them about the RJC. And that was our biggest lesson learned from Clarkston. So organizing locally. As many of you probably already know, when it comes to reproductive rights and reproductive justice, there are many ways that like the state or those in positions of power have attacked the reproductive rights and justice of women, particularly Black, Indigenous, POC, people of color. So many of you may have heard currently in Irwin County detention centers, there have many women have reported that they experienced forced hysterectomies. So or coercive hysterectomies, basically the doctor that was performing, giving them medical gynecological treatments would using their language barrier as a tactic to coerce these women into getting procedures done, particularly hysterectomies, that they did not consent to. Thankfully, due to the brave work of Nurse Dawn Wooten and Project South, we were able to get the story out to the public, and it was reported on, and that's why we know about this. What is happening in Irwin County is probably not just happening in Irwin County. This is probably a nationwide issue. However, Nurse Dawn Wooten, who was the whistleblower, was brave enough to stand up in Georgia, thankfully. So for what NAPOF has been doing with a coalition, the Shutdown Irwin Coalition, and as you guys see on the flyer, there's a few other organizations that are a part of this coalition. We have been calling some of the targets in Irwin County, basically the Irwin County commissioners, as well as the acting field director of ICE Atlanta, to demand that they denounce what is happening in Irwin County, as well as end their contract with LaSalle Corrections, which is the corporation that owns Irwin County Detention Center. Furthermore, what is happening right now is ICE is also trying to deport the women that were witnesses to the egregious acts in Irwin County. And so what we are trying to do is call the Irwin County, the ICE field director in Atlanta to stop the deportation of witnesses in Irwin County. If you guys look at the bottom of this PowerPoint, there is a link with a Google form that has all of this information on there and how you can take action. So I highly, highly encourage, if you guys have the time, please go on the Google form and take action with us.
Great. Thank you, Allison and Soraya. That was really helpful, and I think a great example of what local advocacy really looks like on the ground, both focused specifically on city-related issues, and then, when we think about what's going on at Irwin, it's a federal agency, but playing out on the local level, and how you can react. And you can see that Allison just put the link where you can take action in the chat. And now we'll turn it over to Meg to talk about Kentucky.
Thanks, Jenny. So, hey folks, as I mentioned, I'm with Kentucky Health Justice Network. We're just one partner in the Louisville Safety Zone Coalition effort. So just to give a little background, abortion in Kentucky is extremely restricted. There are 120 counties in the Commonwealth of Kentucky, and one of those counties, Jefferson County, which is also the same municipality as Louisville, is the only county where abortion clinics are located. We have extreme legislative, logistical, and cultural barriers. There are a ton of fake clinics throughout the state, and a lot. So at our abortion fund at KHJN, we hear from a lot of callers who, can't talk about what's going on with someone that they trust, or have sort of dealt with a lot of shame as they're combating those logistical barriers to get to Louisville for an abortion. So we see ongoing and aggressive protests outside of the only clinic, and the asterisk there is to make sure that you all know that prior to March of 2020, EMW Women's Surgical Center in downtown Louisville was the only clinic for decades. In fact, in 2017, EMW's second location in Lexington. So still just one provider, but they did have a second clinic until it got shut down. And then that was when the Louisville clinic became the only clinic, until Planned Parenthood, also in Louisville, got a license to provide abortions at the beginning of the pandemic. So that was a long battle for them. We do have 2 clinics. However, people still have to come from all over the state or a neighboring state. We have 7 states that touch Kentucky, and they all have their own restrictions, waiting periods, gestational limitations, etc. I know Jenny's so without going too deeply into this, it's just to give a little context that we have a lot of room for improvement. Jenny will mention a tool when she shares again about the NIRH's local index. So I'll let her share more about that. But I will say that Louisville has scored 1.5 out of 5 stars on that index. So we know there's a lot of work to do. Next slide, please. So here you see some situations that we count as more extreme. These aren't every day, however, they are not really uncommon. On the right, you see that's just a screen grab that I took from the live video of the first clinic blockade that happened in decades. So that was outside of EMW's doors back in 2017. That is Operation Save America. They're on the ground, and they very intentionally said, we are doing this to inspire similar acts. And those individuals were charged with FACE Act violations, freedom of access to clinic entrances. However, our local PD, all but hated to make that arrest. So what we see on the left there are kind of more common and very tolerated behaviors. So again, lots of room for improvement. Next slide, please. And here are a few other kind of extreme scenarios. So what these 2 pictures show us is that we're not going to be able to eliminate all of the problems that we see in Louisville. However, there are some things we can do. So the picture on the left, if you see on the ground, you'll notice some striped lines. So these 2 pictures were actually taken when Operation Save America returned to Louisville for their 10-day, what do they call it, abortion-free Kentucky. Thanks, Jenny, for the pointer use there. conference. So because of the prior FACE Act violation, a federal court actually placed this temporary zone that you can see. It's just as wide as those columns. They measure 8 feet across on the inside, 10 feet across on the outside, and federal marshals were present to enforce that temporary zone. Might be a little hard to tell, but it was actually helpful given that the rest of the sidewalk looked like what you see on the right there. Next slide, please. So our coalition had already been, at the time of the previous pictures, we had already been working to try to make a difference. So our coalition formed in 2016. It included local organizers, advocates, and attorneys, and we worked including compiling data from patient surveys to put together information packets so that we could educate policymakers and community members. We started working with storytellers and crafting or supporting them in writing testimony to share. And I don't have everybody's logo on one slide, but I will lift up our partners in this coalition, which include the Louisville Clinic Escorts, EMW Clinic itself, Kentucky Health Justice Network, the Kentucky Religious Coalition for Reproductive Choice, Concerned Clergy for Choice Kentucky, Planned Parenthood Louisville, the Kentucky A Fund, Med Students for Choice chapter at the University of Louisville. And while they were are not able to be coalition partners in a sort of unusual circumstance, we actually have had some support from the ACLU of Kentucky. Folks on the call might know that the ACLU sometimes catches flack because their position to defend civil liberties includes those of the protesters. So oftentimes ACLU cannot support buffer zones. However, in Louisville, they have said, let's think about this. So we can go to the next slide, please. And you'll see these are just some of the images from our packets for the council members. You can see the entrance on the left there. I just want to point out, if a person is in a yellow vest, they're actually protesters. And you can see where we've sort of superimposed our dream zone on the ground there, and how obviously there would be plenty of room for protesters to still share their messages on the sidewalk. On the right, you can see an image from a news story about a protester who got knocked down or fell down in the zone. There's another picture in the packet that shows her on the ground in that highlighted space. So the point here is that, this is not just an abortion access issue. This is a public safety issue. This has to, the dangers caused by these protesters can impact anyone in our downtown streets. Right behind where the picture that we're looking at was taken is our Kentucky International Convention Center. There are a lot of large hotels in downtown Louisville. So this is what people see when they come to our compassionate city. Okay, next slide, please. So our coalition persisted. You can see here one of our speakers. You can see the adorable branded t-shirts of the individuals in the crowd. So this is at a Metro Council meeting. You can see a quote from Kelly: simply walking down the sidewalk would result in a protester swarm, even if your business was not clinic related. And so we had some pretty good momentum going on. Next slide, please. And we had people showing up to our meetings, and then 2020 came along. So we made our best efforts to adapt, like everyone did, and we had to acknowledge that this was an incredibly difficult time, and really kind of take the temperature, not in the community, but also for ourselves. People are parenting, people might be ill or losing loved ones, and so we did our best to adapt. And the flyer that you're looking at, or this banner, was for an event that was planned for June 18th. However, this event never actually happened. Next slide, please. Because in May, Louisville had a very different sort of movement moment on our hands. So folks on the call, I hope, are aware that Breonna Taylor was murdered by Louisville Metro PD in her bed while she was asleep back in March of 2020. And it was not until the uprisings in Minneapolis around George Floyd's murder that protests erupted in Louisville as well. So you can see here the memorial that to this day, hold on, Jenny, one sec for me. So this picture was actually taken a couple weeks ago. They're getting close to day 200 of protests in downtown Louisville. We, of course, had to really pause and pivot and figure out how we could both call for the defund. So, we're super grassroots organization. I was actively working as a street medic during a lot of these protests. So we were, in the streets, seeing police brutalize and conduct mass arrests. And here we are calling for the necessary act of defunding or divesting from these abusive systems. But at the same time, we were asking for a new law to be made. So we really had to take a breath and reframe. Next slide, thank you. So we made our way and like tried to balance this moment that we were in, right? Both globally and locally. And our strategy and the outside factors outside of our control shifted repeatedly. So I mentioned the police brutality and mass arrests that became almost daily. The clinic escorts paused escorting in person due to the risks of the pandemic, but the protesters kept gathering in large groups. And of course, these are the Jesus is my mask crowd. So that was really distressing. And we were seeing groups between 30 and 100 people, despite the pandemic. At the same time, Louisville Metro Council was, let's see here, our chief of police was removed from his seat. Some council members called for the resignation of our mayor. So there's been a lot of sort of dynamic shifting in the city official level. And our Metro Council, which actually has a super majority of Democrats and a lot of Black members and community and really members who are really engaged in their communities. So they quickly and unanimously passed Breonna's law. So Breonna's law ends no-knock warrants, and that was for the city of Louisville. We actually have a statewide piece of legislation that is being sponsored by Attica Scott and will be on the floor, I hope anyway, getting hearings next session. So anyway, just a really interesting moment that we were in, but we found that our tools, which you see on the left, this how to engage Metro Council, this was actually an older tool that was developed, but it came in really handy along with our relationships with elected officials and even with the legislative aides. I want to just name that if you are doing lobby work, do not skip those LAs because they know the ins and outs and oftentimes have a lot of influence over the people who they work with. So next slide, please. Okay, so as we found this temporary normal and began mobilizing, we partnered with the clinic and applied pressure through social media campaigns. We also had some people doing some email pushes and kind of private conversations to really make sure the city knew that, regardless of what was going on in Movement for Black Lives actions, we had a really serious safety risk on the sidewalk. So the health department is who is in charge of trying to control COVID spread here in the city. So we launched this 311 reporting campaign and had people every time there was a gathering at the clinic, we pushed it through the app. This was what the council members and the police said, oh, here's where you can report it, because the police couldn't do anything about the COVID, about lack of masking in large gatherings. There's no way to enforce. So these efforts were effective. It took us a little bit by surprise when an unlikely sponsor stepped forward. This was definitely someone who we knew was in support, but we did not count this person as a champion per se. And I need to catch up with my notes. So the draft, hold on, Jenny, give me one sec. Okay, so this sponsor stepped forward, took a draft to the county attorney's office, and came back to us with their product, which we weren't really involved in the authoring of. There had been some other previous drafts, but this one was really, really COVID heavy. Obviously, we understood there was urgency of the moment. And so what we had to do, we ended up having to do damage control instead of getting to work with someone who we knew was going to go to bat for us. We had this kind of unwieldy situation on our hands. So next slide, please. So we continue to engage community members. We got our little talking points pushed out. You can see on the right, we made sure to lift up the really important points and get those in community members' hands as they were contacting their council members. And again, that damage control was going on. I was getting texts from council members about how, they were playing cards for votes and sort of working with other council members on amendments in order to get the votes. And so it was quite an intense time, but we moved towards our committee meeting. So you can see on the left, of course, the bill had to make it through committee first. So we pushed out a way for people to tune in. Jenny mentioned how, yes, this is an incredibly difficult time, but it sure made it easy for people to join and watch these council meetings when they may not have before. Next slide, please. Okay, so the antis started to do the most. On the left here, you see Councilman Engel, who is a, you may be able to guess, staunch Republican. He's face to face with Donna, who somebody referred to as Karen, poor Karen, in her hospital bed on a prior slide. So they started to come out of the woodwork. And so this picture, obviously we put the COVID-19 particles or virus behind him, but this was out on the sidewalk. He came down to the clinic to have this face-to-face conversation. This was the second visit from a Republican. The first one, he did have a mask on, and none of the escorts knew who he was. And when I saw the picture, I was like, oh, that's Scott Reed. So he had come down to warn them that something was going on. So anyway, on the right, you can see that Councilman Engel was quoted in our local paper talking about how we wanted a 50-foot buffer zone. And so you can see an example there of how we kind of quickly whipped up this graphic just to be like, okay, fact check. So this is what we were kind of had going on. Next slide, please. So while the antis did the most, we did as well. And here on the left, you can see, so this quote from Councilman Piagentini, he was actually referring to the protest, to the BLM and Movement for Black Lives protesters, because of course they were catching, the city and the police were catching a lot of negative feedback for the police brutality and mass arrests going on, especially jailing people for nonviolent protests during a pandemic. So Piagentini thought that he was being clever, and we just simply applied it to a different kind of protester. He got really upset on Twitter about this, y'all. He's actually really upset on Twitter about something else right now. It's pretty funny. So anyway, and the meme on the right does not need any explanation, but point being, we became little meme machines during this moment in time. Next slide, please. Okay, so here we go, time for a vote. So again, we had a supermajority of Dems. And however, we also know that there's a really deep, longstanding Catholic influence in our city. So in attempts to make this law sort of more palatable to their colleagues, our sponsors and supporters on the council did all of these little gymnastics moves. And so they asked for the law to apply to all healthcare facilities instead of reproductive healthcare facilities, which we can live with. It's not a bad thing. There's a hospital here who that where one of the abortion docs works, and she gets targeted there sometimes. Protesters have also picketed a pediatrician's office because that doc is married to an abortion provider in Indianapolis. So it's kind of wild around here. But other less palatable amendment attempts were to require the facility to hire private security in order to have the law apply to them. And because the sort of impetus to moving to introducing this bill at this moment had to do with the pandemic, some council members said, okay, well then let's have it expire when the pandemic ends. So that was kind of what that was what that closed door card playing was about, and it was not cute. So during this meeting, there were some rules enacted, including putting a time limit on the amount of debate that could happen. And so after some discussion of amendments and a timer went off, there was a vote. And unfortunately, we were 2 votes short of our 14 that we needed to win. So next slide, please. Y'all may know they cannot get rid of us that easily. We've been at this since 2016 already. So you can see here, big shout out to my team who are pictured on the left there. Savannah, who's in the middle, gets most of the credit for this slideshow. I've really pulled all of these from her Canva work. And so what we know at this moment is that there are new council members that will be taking their seats in January. Again, remember, we only missed it by 2 votes. So one of those council members, the new council member for the district that EMW is in, is already talking about reintroduction. As will come as no surprise, things are still really bad down on the sidewalk. And kind of one of the most exciting, for me anyway, exciting things about this moment is that LMPD and Metro Council really know that they're on notice at this point. There is a very active take the seat and Metro Council watch team groups that are watching Metro Council, because we don't have to go back to it, but if you remember the call to action slide earlier, they're still doing so. We had an FOP contract go through, fraternal order of police contract went through just recently. We had to apply a bunch of pressure then, and then just yesterday they did pass, or I'm sorry, Thursday they did pass the bill to create a citizen review board for our police. So we've continued to kind of stay in coalition with our partners, but also to expand as we obviously do not live single issue lives, even in this one county. So, I want to plug, you can see on the right there, on December 2nd, we will be sitting down with Liz Winstead at Abortion Access Front to talk more in depth. So there's a tiny URL that you can see, and I'll get it in the chat here in a moment. Oh, I want to drop one more, and I need to go back and grab my link. So I'm going to put it in the chat, y'all. I want you to check out this article, and I'll put it in the app as well. But there is an article that just came out this week that really focuses on the difference in treatment between anti-abortion protesters and Movement for Black Lives protesters, and the reporter really profiles Louisville and our efforts in that article. So I think that's it.
Thank you so much, Meg. That was inspiring and, a little disheartening too. There's such a need for the buffer zone. And it sucks that it didn't work out last time, but obviously you're not going anywhere. So hopefully those 2 case studies provided an overview of what local advocacy on the ground can really look like. And I think it's no mistake that both of the examples that we had here are from blue or bluish cities in red states. Local advocacy has an impact everywhere, but it's really exciting to think about what cities in red states can still do in particular. I think also the 2 case studies showed what, in one case, proactive work looks like, building this RJ commission to think about what could Atlanta do and be, and then the real power in defensive work that also educates and has a proactive goal. So now, a training is difficult to do in a webinar when we're not all together. But so what we wanted to leave you all with are some tools and tips that you could bring back to engage in local advocacy in your community. So Arpita and I are going to talk a little bit about what's in the tools that NARH has available, offer some tips, but really what we hope is that if any of this piques your interest or feels useful, that you'll reach out to us and we can do a full deep dive into whatever of the tools are that, that you're interested in. So I'm going to start with the tools. The first tool is what Meg alluded to, the Local Reproductive Freedom Index. This is sort of our flagship publication now, and what most of our local work is organized around, as you'll see from the rest of my presentation. So this comes out every other year. So 2021 in October or around there is when the next edition will come out, which will be the 3rd edition. It looks at 50 cities on 37 different policy indicators related to reproductive health, rights, and justice. We put this together so that, for a few different reasons, so that cities could see that there were at least 37 different things they could do locally in support of reproductive freedom, so that folks could compare themselves to each other. Like, I know that this is the classic example I use, but Minneapolis and St. Paul are quite competitive. So we wanted to kind of pit them against each other. And we hope that that could be useful, but also in a more friendly, loving way that, Louisville could say, hey, we're actually not too different politically or geographically or budget-wise from maybe not Atlanta, but I'll just say Atlanta. And so let's see what Atlanta has on the books. Like, maybe that is a policy that makes sense for us. So that was really the impetus for putting this together. It includes a lot of information. So you can see the Buffalo scorecard. Each of the 50 cities included in the local index gets a scorecard like that. We hope you could print it out, bring it to a city council meeting or to your mayor, and just use it as a handy tool to make your own plans. Under this orange bar, protecting abortion access. On the next slide, I'll talk about our model city, but it uses 6 categories to talk about what cities can do to support reproductive freedom. And then we offer policy ideas within each of those 6 categories. So this one's abortion access, but there's 5 others. And then we know that there's a lot more than 50 cities, and many of them are really important and have great activists. So we do not have plans right now to add more cities to the local index, but we do want to help folks create their own scorecards. So we have this self-scoring tool. What you see on here is like an Excel file you can download to literally get your score. But we also have a guide to how we did the research, what each of the indicators mean. And of course, if anyone wants to do this in their community, I can also talk you through it. This is all really original research that we did. Most of the data, besides some demographic information, is not all in one place. So it's a lot of work, and we're happy to share what we know about how to do it with you all. The other tool that we have is called the Model City. And so this is in the centerpiece of the local index. It's how we organize all of the policies we look at, but it also is designed to help inspire people. So, one of the reasons we created the Model City was because there are a few cities like New York City, San Francisco, those that are in very blue states with big budgets, who have achieved most of the policy indicators that we've checked off. But what we wanted them to be able to do was to look at this model city and say, okay, so we have checked all the boxes, but is our support for pregnant people really as beautiful as every family grows up in a healthy, safe, secure environment, has a healthy pregnancy and has access to everything they need? Maybe not. So let's use the model city to think about how we can push further. It also allows for more nuance. So, when I think about CompSex Ed, for instance, you could check a box if you have CompSex Ed, but then we can't actually check a box that says, or we can't easily present information saying there's K through 12 sex education, and every school has it, and every teacher is trained in it, et cetera. So this is designed to really help people dream big and inspire them. And we hope hang it up on their wall, maybe. We think that the local index is hopefully really useful, but we wanted to get even more explicit. So we created 4 tools to help people use the local index in their communities. So there is a tool for advocates to think about how to use the local index to advance policy. We also, and so here, this is just something I pulled out, we have a sample meeting agenda in that tool for how to actually set up a meeting with your elected official you want to champion and what to talk through. Of course, you can modify this, but that's how concrete it gets. We also have a tool for advocates on how to engage in local elections to advance reproductive freedom. And that some of it is C4 only, but some of it can be done by C3s. And then we actually have 2 tools one for elected officials, how can they be champions for reproductive freedom and use the local index? And then one for candidates, how can they present themselves as a candidate that supports abortion access, reproductive health, rights, and justice? And we hope, that you could give those to any champions you have who might be interested in that. And then we actually have a new tool coming out on December 2nd, same date as that big event with Liz Winstead. And this is actually a special report of the local index on COVID-19. We wanted to look at how cities are responding to the pandemic in ways that center reproductive health, rights, and justice. And so you can see 2 examples here that I pulled out. Municipal funding for abortion that this year happened in Austin and New York City, and really explicitly was tied to the economic need for abortion access this year. If you're interested actually in learning more about municipal funding, quick plug, I'm doing a panel tomorrow at 11 a.m. with folks from Austin and New York City to talk about how we specifically did that. And then for people who don't understand why it's important to protect reproductive freedom in a pandemic and center that in your response, we put together 10 principles that really explain why it's so essential to a pandemic response. I don't have time to go through them now, but the report's coming out December 2nd, so you'll get it soon. And then just a few tips, and if folks are having questions, can you chat them in, because we want to make sure that we're getting time, and that can determine how quickly I speak and how fast we go. But we have ideas for all of the 6 categories of the model city on what policies you can advance. But I really wanted to pull out abortion here just because it's the one people often don't realize how much cities and counties can do. So funding abortion access, I mentioned we have a presentation tomorrow. We also have a toolkit, but it's quite confidential. So if you're interested in that, please email me. Addressing practices of anti-abortion pregnancy centers, or you might know them as CPCs, crisis pregnancy centers. There are things that cities can do, even if you have heard about some court cases that have struck down some provisions. There's still more to do. Raise public awareness about abortion access. When I think about Georgia and that they passed this ban on abortion, something that the RJ Commission could have done if it was in existence at that time was make sure people knew that abortion was still accessible and legal in the state, right? And in the city, as one example, but there's many. Protecting patient access to clinics, as Meg spoke about, buffer zones and other clinic safety ordinances, supporting training in abortion care. So this can be partnering with a county hospital or city hospital to ensure that residents who are training there actually learn how to provide abortions. And that's been done in multiple places. pass resolutions that are related to state or federal bills to show your support and proclaim commitment to abortion access. In New Jersey, there's a proactive bill right now that's being passed, and we're considering working with multiple cities to pass resolutions. And then March 10th, every year, we celebrate as Abortion Provider Appreciation Day. Your city or county could recognize that day officially and take action to support and celebrate the abortion providers in their communities or who their residents go to for care. I've also got a toolkit for that, lots of tools. That one you can get on our website if you just go to narhealth.org. And then this tip of identifying a policy or agenda, I've just pulled out from one of the tools on using the local index. This is, the sort of the format we would recommend if you want to do something in your community, but you aren't sure where to start. So it's just asking these questions of yourselves, gather together your partners, your base, your coalition, your two best friends, whatever it might be, and ask yourself, which policies are responsive to the most pressing challenges in our community? And the local index could be helpful here, or you could look outside of it. Which policies seem to be in line with our community's values and our coalition's values? Which policies seem the most achievable here? And then which policies have been instituted in cities similar to ours, as I mentioned? And then, hopefully you'll have a list of a few. And then you can go through and think about, which of these policies is most effective? What do we have the resources and time to focus on? What is the most popular with our allies? And you might still end up with 3. And then instead of having one policy to organize around, make those 3 policies into the agenda for reproductive freedom in Oklahoma City, or whatever city you might be in. But ultimately, you'll probably need to do one at a time, but you can create that vision. I'm going to just quickly touch on this because it's in the tools, but you don't have to just think about city council or county government. There are many local bodies that have power over our issues. School board is often where sex ed decisions are made, but not just sex ed. What policies are there for LGBTQ students? Do you have school-based health centers in your schools? Do they offer people contraception or, referrals for family planning? Can you work with the school board to make that happen? And criminal justice positions, of course, police reform, transforming or abolishing the criminal punishment system are reproductive justice issues, but also, thinking about the access to care for people who are incarcerated. Is self-managed abortion criminalized? Is sex work criminalized? Can it be decriminalized? There are many ways that these issues touch our work. I'll also just mention the Department of Health as another key entity to think about. And then I'm going to turn it to Arpita.
Hey, everyone. Thanks, Jenny. I'm going to really quickly move through just a couple of messaging tips. So we call this the abortion values messaging triangle. And what you're looking at here is in the middle of the triangle, this is what our movement shares as our operating value. When someone decides to have an abortion, it should be safe, affordable, and free from punishment or judgment. This is a tested statement. This is a tried and true statement that the public agrees with. And, around the messaging triangle, you'll see our strategy. You'll see that the problem is that anti-abortion politicians will stop at nothing. We see that over and over again. It is a lasting problem. The vision that we have to reach this goal in the middle is that living a safe and healthy life is a basic right. We should all have the rights, freedoms, and opportunities to control our lives. So this vision is about autonomy. Polling data shows us that the American public holds autonomy to be a really central value to living their life. And so the more we talk about abortion as part of ensuring autonomy for all Americans, the more likely we are to change minds and hearts. The solution here is with increased threats to abortion care, we need to ensure that abortion care remains safe, legal, and accessible. So this triangle and the pieces around it, this is the abortion values messaging triangle. You can create a messaging triangle for anything that you're trying to accomplish in your city or county. So for the Louisville Safety Zone Commission, they can create a messaging triangle related to trying to accomplish the safety zone. For the RJ Commission, they can create a messaging triangle related to pushing the RJ Commission to make changes or pushing people forward on Irwin County Detention Center. So take a look at that messaging triangle, and please, we have this in a bunch of our toolkits, as Jenny said, so reach out to us if you want more information. And then lastly, I'm gonna just say that talking about abortion is really hard. It's hard to get the message across. It's hard to make sure people are hearing you. And so something that we often offer in a lot of our messaging toolkits is kind of a say this, don't say that type of an exercise. So for example, here, if you listen to mainstream media, you will hear a lot of talk about pro-life people and pro-choice people. We should not be repeating those messages. What we should say instead are anti-abortion people, opponents of abortion access. What we should say instead is supporting abortion rights and access, rather than pro quote unquote choice. Choice doesn't talk about access, and that's really what we're wanting to talk about. You'll see more say this, not that on the next slide. And I think the one on here that I hear the most is this top one. Abortion is difficult or heartbreaking, and no one wants to have an abortion. This is
Alex Moody,
a stigmatizing piece of information, and we want people to know that abortion is a complex experience. People experience it in different ways. I am, as a side gig, also a volunteer on the All Options Talk line, and I can tell you that every single call I get on there about abortion experiences is different from the one previous, and it's gonna be different from the next one I get. So take a look at these, reach out to Jenny or myself if you want more of these say this, not that type of information. And yeah, I know we didn't leave an incredible amount of time for questions. We are, we're wordy folk, but there are our email addresses and our names. I love that you all were using the chat during that. And thank you guys so much for attending. If you have any questions, reach out to us. And have a great rest of this wonderful conference. Thank you so much to Justice Now and to our interpreters, Nikki and Kat. Thank you guys so much. And definitely reach out to all of us if you have any questions.
thank you. Enjoy the rest of the conference. I'm excited to see what y'all do in your communities.